This is the Emergency Medical Minute, sponsored by CarePoint and HCA Health One.
So we often have to put in central lines, right, for patients who are sick, who need pressors usually, right? And there's lots of locations that we can put them in. We put them in their neck, as in the IJ. We can put them in the subclavian. Also, the femoral vein is another source, another site that we can place a central line. And you guys, where do you most commonly see us place central lines? In the neck, right? Huh? You gesture to the neck, right? Okay. That is a very common place to put it. And then do you more commonly see it placed on the right or the left? Right. The right. So the right IJ is a very common site for placing a central line because it's just like a straight shot straight to the right atrium, just a straight shot down. So it makes sense that we do that. Now, the thing is that if you do that, that kind of is occupying a site where patients can only get dialysis or get ECMO or CRRT or things like that. So it is true that this is like a great site, but it's a great site for that reason, and you're kind of also taking the site away for the patient for other things they may need down the road. There was a study that was done that it was in the Journal of Critical Care, and it was titled Right IJ CVC Associated with Hemodialysis Catheter Complications. And so initiating right IJ catheters as opposed to the left results in less favorable outcomes for hemodialysis later on. The right IJs required more frequent hemodialysis catheter recannulation, so 40% compared to 2.6%, and a higher incidence of hemodialysis catheter exchange over a guide wire with the right IJs versus the left. There's also a significantly greater number of venous interventions that are required. So basically, we should probably be doing, if you can do a right IJ, we should be doing a left. You can also probably do a left IJ. So that's all. Just quick little medical minute on central lines.
This has been the Emergency Medical Minute. Thank you to our sponsors CarePoint and HCA Health One. Support from them and listeners like you helps us to continue providing free medical education to the masses. If you found this episode valuable, consider supporting our work and check out the link in our show notes.